Do I have an anxiety disorder? This is a question many people ask themselves. While anxiety is the most common mental illness in the United States, affecting 18% of people, the term is commonly misunderstood and misused. In this video, we will explain what anxiety is, what some of the most common anxiety disorders are, and even why anxiety is positive. Welcome to Mental Health Collaborative, a nonprofit organization dedicated to educating our community in mental health literacy. We believe that a foundational education about mental health promotion and understanding mental health and mental illness will lead to more resilient communities and decreased stigma. We believe that mental health literacy is a right and need of every citizen. Thank you for joining us. Anxiety disorders are disorders of signaling, meaning there is an irrational response in the brain. It could be an irrationally large response to a small signal, or a response to no signal at all. We all feel worried and stressed from time to time. However, this does not mean that we have an anxiety disorder. Feeling worried and stressed in reaction to a stressful situation is healthy and normal. It is actually an adaptive response and leads to resilience, problem solving, and learning. For example, feeling nervous before a job interview is a normal stress response. You want to perform well because the interview is important, but you may not know exactly what the questions will be. This is a signal or trigger which causes a stress response. The fight or flight response in our bodies raises our heart rate and causes us to sweat, amongst other things. This puts us in alert mode, which is good for us in many stressful situations. The fight or flight response was built in our bodies to help us. It allows us to run faster if we are being chased by a wild animal and be more attuned to our surroundings in any dangerous situation. We may label the feelings of nervousness and alertness as anxiety, but it is important to remember that this fleeting nervousness is a healthy reaction to a stressful trigger. We all feel stress, and in most cases, it helps us to perform better. Having a stress response does not mean that we suffer from an anxiety disorder. When a person suffers from an anxiety disorder, they experience hyperarousal or overactivity of the stress response. Their anxiety is irrational, chronic, and disruptive. They often worry excessively about small triggers, and that worry can spiral into worst-case scenarios, including abandonment, humiliation, and even death. They can be anxious without any triggers. This does not happen once, but it happens often. It could be before going to every work meeting, each time they're in a crowd, or recurring without any pattern at all. This anxiety interferes with their life, causing symptoms like disruption in sleep, avoidance of social events, physical symptoms like their throat closing, to name a few. Anxiety disorders always impair functioning to some degree in work, school, and/or in social relationships. There are many different kinds of anxiety disorders. Today we will look at panic disorder, social anxiety disorder, and generalized anxiety disorder. What does a panic attack look like? Panic attacks are characterized by rapid thoughts, extreme worry, and a disproportionate reaction to a stressor. Your heart may begin to race. You may feel weak, dizzy, or faint, with a sense of terror. You might experience tingling in the hands or fingers, chills, sweating, and chest pain. Many people have had a panic attack, but that does not mean that they have panic disorder. Having a panic attack does not mean that you will develop a panic disorder. A person with panic disorder has recurrent panic attacks without obvious cause, fears of future panic attacks, and avoids situations that are hard to escape from. Panic disorder, like other anxiety disorders, is due to a disturbance in brain functioning and requires professional treatment. Social anxiety disorder is characterized by persistent and intense fear of judgment, criticism, and humiliation in social situations. These fears are out of proportion and often cause panic attacks, like in the example we gave. While someone with panic disorder often has panic attacks without a trigger, someone with social anxiety disorder is specifically triggered by social situations. A third common anxiety disorder is generalized anxiety disorder, which is characterized by persistent physical symptoms, like headache and stomachache, with no medical explanation, intense and persistent worrying and need for reassurance, difficulty letting go of everyday worries, and persistent tension or feeling on edge. Now let's talk about treatment. The good news is that with proper evaluation and treatment, anxiety disorders are very treatable. When anxiety disorders go untreated, they can lead to substance use disorders, functional impairment, and depression. It is very important to seek help if you are suffering from an anxiety disorder. It is also very important not to self-diagnose. If you are worried about having an anxiety disorder, it is important to see a professional to get the proper diagnosis and treatment. Cognitive behavioral therapy and medications like SSRIs are effective treatments for anxiety disorders, though it may take up to 10 weeks to see significant improvement. Often, when people don't feel better right away, they stop treatment, so it's important to know that this takes time. Unfortunately, only 37% of people who suffer from anxiety disorders get treatment. This could be due to many reasons, like stigma, lack of access to healthcare, or not knowing that they have an anxiety disorder. This is why language matters when talking about mental illness. Many of us say we have anxiety when we're really just having normal stress response and feelings of worry. Others may blow off someone's intense and irrational anxiety as being too dramatic or overreactive. Both of these are harmful to people who suffer from anxiety disorders, as they downplay the severity of the illness. People with anxiety disorders cannot help the symptoms they suffer from, and those symptoms prevent them from fully functioning. We wouldn't say we had pneumonia if we had a cold. If we had a cold, we would take it easy and rest more, perhaps take Tylenol, but we wouldn't rush to a doctor or hospital as we would if we had a fever, difficulty breathing, and symptoms of pneumonia. The same is true for mental illness. Feeling stressed does not warrant professional psychiatric care, but having an anxiety disorder does. If you or someone you know is suffering from an anxiety disorder, see the resources in the description for how to get help. We hope you found this information helpful. We at Mental Health Collaborative are committed to providing education and increasing awareness about all of the interrelated states of mental health. We hope that by doing this, stigma decreases and more people get proper treatment and support for mental illnesses, learn when to get help, where to get help, and what to expect when they get there.